right, so welcome to this episode of MTMM Radio. We're starting a segment that we're going to be discussing a couple themes that we continuously see within the community, and we thought that it was really important to bring them to light. So I'm going to be sitting down with Kat for a few episodes, and as well we're going to bring in our newest member of the MTMM nutritionist team, Claire. So you guys will get to meet her soon, which is very exciting. So the two themes that we often see primarily with women, but also to a lesser extent men as well, are struggles with fertility. And this is something that I feel like, or we feel like people, they feel silenced about, and they feel like they can't really talk about. It's still a little bit taboo. And the access to support that we have for a lot of other issues is not necessarily available for people to discuss and talk about these issues as freely. It can get a bit awkward, it's uncomfortable, and to discuss with family and friends. So we don't see that people are opening up with a lot of dialogue about it. So we wanted to bring this to light because it is such a common issue. And we wanted to give others the opportunity to talk freely about it as well. The other aspect is that we work with a lot of women, whether it be before pregnancy, during pregnancy, or after. And we see that they do require a lot of support in terms of the mental and emotional side of the entire process, specifically when it comes to body image, food guilt, and just generally knowing how to fuel themselves, and to have that support throughout the process. So we wanted to kind of give everybody an opportunity to join in on this chat. Like I said, we're going to be sitting down with Kat for a few episodes, and then we're also going to be chatting with Claire. So as I mentioned, she's our newest nutritionist on the MTMM team. She's also a mother of 3, so she first-handedly has gone through these types of experiences before, and she's also worked with a wide range of clients who have also been pre-pregnancy, during pregnancy, and post-pregnancy as well. So there's a whole wealth of knowledge there, and a whole nother perspective as well. So I'm going to open up the floor to Kat, who's going to tell us a little bit about what her and Ben have been going through recently.
Yeah, so I think that, obviously this topic has come up and become really prevalent for us as we've watched a lot of our friends get pregnant right away or really struggle trying to get pregnant. And then about a year and a half ago, Ben and I decided we were ready to start a family, and so started trying to get pregnant at that time. I kind of knew within the first few months when nothing was really happening that there was something a bit amiss, and I was like, we should go get some testing done. And Ben was very apprehensive. He was like, no, we don't need anything done. We'll just keep trying. It's just not the right time. And after about a year, we'd moved back to Australia, and it was like, okay, it's really time. I'm like, there's something to be done here. Ben was born prematurely, and he had a history of an undescended testicle, which was he had surgery to correct when he was about 11 years old. And so that massively increases your risk for infertility, amongst other things. And so I kind of already knew what was happening. I just really, really hoped that I was wrong. So we went in, we did our first round of testing with our GP. And I think even though I knew, I wasn't expecting to have the door slammed in my face so quickly. So first round of testing, first semen analysis, they were like, there's no sperm. Which when you have male factor infertility rate like that is a really big challenge, and there's not a ton of options. So they're like, you know what, it could be a laboratory error. Let's just get another test done. We'll refer you to a fertility specialist. Did our second test, result was the same. So we went and we started seeing an IVF doctor to see what was kind of the options out there for us. And so they said, look, in these cases, sometimes we can go in, we can do a biopsy. We find that a few of the sperm cells are actually producing a little bit, and so we can surgically retrieve them. But basically, if that doesn't work, your options are looking at donor sperm or adoption. So, and interestingly, Ben and I both have a lot of family members who are adopted, and I know people that have done donor sperm, but we were very opposed to those ideas, and I really didn't like my reaction to that. I was like, oh, I thought I was a bit more open-minded than that, but whole other thing. So we're like, yep, okay, we'll do the biopsy. And as we were getting prepped and going through kind of all of the pre-procedure stuff for that, part of it was that Ben had to have a testicular ultrasound. And again, like having this foresight and a bit of medical knowledge, Ben was like, oh, she was really like doing a lot of clucking during my ultrasound. She's like, which is never a good sign.
And not something that you should do either.
No, I was like, uh-oh. And so immediately, like, I went to panic place, and I was like, my fucking husband has cancer. Because you know, the issues that he'd had being premature and with the undescended testicle, that also raises your risk of testicular cancer hugely. And so anyways, we got phone call the next day to come in an emergency meeting with the IVF specialist. I was like, well, that's not good. And he was like, yep, so we found some malignancies on the ultrasound. I need to refer you to a surgeon. We need to put the IVF stuff on hold while you deal with this. So I was like, yep, cool. Can I just be wrong once? Anyways, we got this amazing urologist. And he phoned me the next day because I had made an appointment and his staff had got Ben in the following week. And he phones me at home the next day. He's like, can you guys actually come in now? He's like, I'm practicing out of this office not too far away from you. I'm done for the day. I will wait here until you get here. And Ben was out with his mom, was like, oh, like, that's really not good.
Yeah.
So anyways, we go in there. They're like, yeah, it's highly suspicious. Also, Ben's hormone levels were completely out of whack. And they're like, so we need to do surgery. We're going to get you in 10 days. So we basically went from diagnosis to surgery in a week and a half. And we were very, very fortunate, though, in the physician that we had. The surgeon that we had was excellent. He was able to go in and do what's called micro tease. So this is Ben's description of it, but I think it's very appropriate. So they basically went in, took out his testicle, and then, you know, those like slicers for hard-boiled eggs?
Yes. Oh, no.
They essentially sliced through his testicle and went searching and looked for 3 hours to see if they could find any. So it's not funny at all, but like, you have to laugh or you're in massive trouble with this stuff.
If anybody knows Ben, he's been laughing it off for quite some time, and it's been the best.
Since like day one, yeah. So they went in and spent 3 hours hunting through. They found out that about 5% of his cells were actually producing sperm. And so they were able to get 12 straws, which is essentially, most IVF cycles will take about 1 straw per cycle. So they actually think they did quite well. They were super happy. From an oncology standpoint, we followed up with oncology. They're happy that everything's completely gone. CT is completely clear. No need for any further follow-up anywhere down the line. But as like a PSA to any male listeners that we might have at the moment, check your balls. Because this was you know, a totally incidental finding. If we hadn't been going through IVF, we never would have found it. So we're very lucky. And it's been a very good result in that. But that was about a month before our wedding. And now we are a month after our wedding, and we've decided that we're going to go ahead and start the first cycle of IVF. So it's been a bit of a whirlwind.
Does it affect the potential outcome, whether or not you wait or do it right away?
No, so ideally they didn't want to freeze Ben's sperm because they were thinking it might be a bit fragile, but just with the 10-day timeline from diagnosis to surgery, there wasn't enough time for me to do an IVF cycle, and so we had to freeze it. Once it's frozen, it makes no difference whatsoever. And for us, we've got a lot of other things going on, both personally and professionally right now. And so I was kind of like, maybe we should wait, like maybe the new year's a little bit better, you know, when this situation resolves or this situation. And I mean, Ben is like stupidly excited. Like he's so clucky. So he's like, no. But also I think, you know, he has a point in that when is it ever going to be the perfect time, right? It's so interesting when you go through that process of like, okay, like if it happens, it happens. Like, I guess we can handle it, to, okay, like, we're ready. Let's try and have a baby. Like, okay, I'm ovulating. Like, let's go, to like, okay, we're actually going to pick a day in the calendar. I mean, you don't have much choice over the day, but where we call in and we hand over our credit card and give you $15,000, and like, we're scheduling this, right? So no, it doesn't make a difference when we do it, but we just figured
there's been so
we
much
may as well get started. I'm not
at this
Yeah,
point. Yeah.
exactly. And like, I'm not getting any younger either, and we don't know how things will go. We're doing the most kind of intensive form of IVF there is, but you know, like, it could still take a lot of time. It could still not happen. So I'm almost 33, and my eggs, like, my Mullerian reserve is really good right now. So that we kind of want to capitalize on that, because the rates really do start to drop after 35.
Right.
So onwards and upwards.
Onwards. Yep.
Yeah. So it's been interesting though, because I'm very vocal and outward, and I deal with things by talking about them. And Ben is very much the opposite. And I think as a couple that, and because it wasn't just the fertility thing, right? It was the tumor, it was the cancer, it was, he had concerns over not wanting to tell people because he didn't want to be treated differently. He didn't want people to treat him like he was sick. He didn't want people to say, oh, like, maybe now's not a good time to sign on with the business because they're busy. Like, he didn't want any of that. Right. And so keeping quiet about it initially was very difficult for me. And so I know so many women who have gone through similar things, or miscarriages, or just, you know, all these different fertility related issues, who haven't been able to speak publicly about it. And I think that would be so difficult. Yeah. I think we were about like a week into it, and I was like, you got to tell people. I was like, I can't keep this in anymore.
Especially for that type of person, right, who really needs to talk to people about it. And if there's nobody there, then that would cause tremendous.
That being said, though, I feel like as soon as Ben started telling people, it was like this massive weight off his chest as well, you know? And instead of getting the, oh, so when are you guys going to have kids? We have a lot more conversations about, how are you going? And like, how are you feeling? How's life? What else is going on? And it just becomes a lot easier.
Yeah,
right?
Pressure too, probably.
Yeah, absolutely. Because it's like, we're doing what we can.
Yeah. And so what has the process been like so far with the IVF?
Yeah, so it's been interesting. So I will give, obviously, like, my IVF experience is going to be unique to me, but even like the way that my cycle is mapped out is not going to be the same as someone else. But to give you like kind of a baseline overview of the process, what happens is, on, you know, day 1 of bleeding, you call in, pay your money, start your cycle, they get you all set up. And then on day 3, I start taking FSH by injection. So you're injecting yourself once a day with these massive doses of follicle stimulating hormone, which are the hormone that get you to produce and grow eggs. So normally you would grow 1 egg per cycle. You would ovulate, kick it out, see if you can get pregnant. I have a normal cycle. I have no issues whatsoever. I'm kind of clockwork to the day. All of my blood work, all of my Mullerian reserve, everything came back totally normal. So there was, luckily for us, no female infertility factors to deal with. So they kind of thought for me, just this would be like a standard cycle. So what they do is they give you a ton of FSH, so that instead of growing and maturing 1 follicle or 1 egg every month, you grow a ton. Hopefully not too many. They're trying not to overstimulate you, because that can have pretty serious health problems as well. But basically, so sorry, Ben is trying to give me food. Please go away. So they'll stimulate your follicles to produce more eggs each month, and they'll monitor this. So after about 5 days on the FSH, you'll go do an internal ultrasound, and they'll see how many follicles are growing. You'll continue the FSH, and you can kind of think of the FSH as like pumping the gas on a car, right? It's like, go more, go more, go more, go more. They'll do another scan a few days later. And once they see that those eggs are getting pretty much ready to go, then they'll add in a second injection every day, which is essentially the brakes on the car. So they're still pumping the gas, you're still pumping that full-heartedly, but now you're throwing brakes on. So you're essentially like doing wheelies in the parking lot. Because they don't actually want you to start ejecting those eggs early, right? They'll do another scan, and once they determine that those follicles have matured as much as they're going to, you'll get a massive dose of HCG, which acts as a trigger. And then 24 hours later, you go in for general anesthetic and like full-blown surgery, and they'll go and remove all of those eggs. So at the same time, they're going to thaw out some of Ben's sperm, and then we're doing what's called ICSI. And so that is essentially, instead of just putting the eggs and the sperm together in a petri dish, they're going to find the best sperm they can and take it into a pipette and inject it directly into the egg, so that Ben's sperm don't have to swim. They don't have to do anything. They can just be lazy as. Yeah, so, and then basically they'll grow it in that petri dish for anywhere from kind of 2 to 5 days. The longer they can grow it and the more cell differentiation they can see, the better off you are, because they'll implant better quality eggs, and then they'll choose the best looking one of the bunch. If there is one that's had successful fertilization, that's never a given, and they'll do a transfer, which is essentially like turkey baster.
Right.
So and then at that point, you are waiting about a week, taking a blood test. And at that point, if it's positive, then you are biochemically pregnant. So that would be the same as just if you conceive naturally, get a positive pregnancy test. Great. Still holding your breath a little bit until kind of you have your first ultrasound, which would show a heartbeat, because you can be biochemically pregnant and then it can fail to develop. So
which
yeah,
a natural pregnancy as well.
Totally. Yeah. Then it's kind of like at that point on, it's just like as per normal.
Right.
So essentially where I'm at right now is I am on like day 10 or 11 of my cycle. So I started the FSH injections a week ago, actually, and I started them on a very high dose, like very, very high, which I thought was interesting. And these can cause like basically like all your PMS symptoms, they can cause them to skyrocket. I haven't really had too much. I've had like some pretty extreme fatigue, but it's not being consistent. It's like, I think my second day of the injections, I got up at 7 or 7:30, took the dog for a walk, was back in bed by 10:30 and passed out. And I haven't had a nap outside of jet lag in years.
And what are your typical PMS symptoms like? Do you usually get?
I usually get some fatigue, but not like that. I usually get really, really super sore breasts. Ben can tell you exactly what day I'm on based on my mood. I do tend to get like pretty short, pretty cranky, get really hot towards the end of my cycle. And typically I don't have a ton of pain until after I've actually started menstruating. So that was the only nice thing, is like I started my FSH injections and it like stopped my period immediately. So I had like a 2-day period, right, which was nice. But the fatigue has been nuts. Like I was at the gym the other day and I passed out on a bench, like fully asleep.
So unlike Kat, for anybody who knows Kat. Yeah, that would
never Ben came up to me and I had my hood over top of me and he's like, why don't you go home and I'll get our friend to drive us home after the class. I was like, no. I was like, I'm doing the class. It's fine. I was like, I just need to have a little power nap. Yeah. So I had my narcoleptic power nap and then went in and like smashed my Jackie time. So my workouts are actually feeling super good. I feel really strong. I feel really good. But I've just had these moments of like extreme fatigue. Mm-hmm. And also like, I don't know if I'm having more cravings or like just wanting to eat like all the carbs and fat and none of the protein, or if it's more of like a psychosomatic thing, like, oh, it's okay, you're going through this, like you can have a day off sort of thing. So it's been a struggle to hit my macros this week. I think that's more of like a head thing. I don't think that's real.
Have you made any adjustments to your macros? Is there any specific protocols or anything like that you've?
So Claire has actually been working on my macros for me, and we've kind of been chatting about them together. And the only changes I've really made are I essentially went straight from my nationals cut into this process, right? So I hadn't reversed myself out of that cut because I'd kind of taken a week off to just eat intuitively. And so I'm on like 1700, or I was on like 1700 calories a day when we started, which obviously needed to go up regardless of the IVF stuff. So we're slowly just starting to build me up kind of in a similar way that we would have anyways. So my protein is at about 175 grams. My carbs are at 140, and then my fats are at 60. And we like, that's kind of been our baseline, and we're moving from there. We will look to increase my carb intake just because once, hopefully if I do become pregnant, every woman needs a baseline of like 175 grams of carbs when they're pregnant. Mm-hmm. So it's like we need to start moving towards that anyways. So that's kind of what we're doing. But yeah, it's been a struggle to be motivated with it.
Yeah, I can see why. And have you noticed any changes in terms of like your body composition due to the IVF, not the macronutrient increase?
Yes, 100%. So I put on almost 3 kilos so far. In like not even a week and a half. That was in like the first few days. And it's primarily fluid, right? Because it does cause fluid retention. And if you think about when you're coming up to ovulation and post-ovulation in your normal cycle, you get a little bit like swollen in the lower abdomen. Sometimes you can feel what side that egg is growing on, like the follicle is swollen and bigger. Well, I went in for my first scan on Friday, and he's like, all right, let's see how we're looking. He's like, yep, lining looks good, everything like that. He's like, okay. He's like, so eggs. He's like, on the left side, you have, he's like, you've got at least 12 here. And then he's like, on the right side, he's like, okay, a little bit less. He's like, you've got 9. He's like, so that's a very good response. He's like, you should get at least 15 good eggs out of that when we do the surgery. But yeah, so I was like, okay, so that explains why I feel like a bag of popcorn is what I feel like. Like, if you watch a bag of popcorn in the microwave and it starts to expand and expand and expand, and then all of a sudden there's these popcorn kernels coming out of the top.
Yeah.
Like that is what I feel like. I'm like so full of popcorn.
It's like really bloated.
So bloated. Like I keep rubbing like my lower abdomen, and I'm like, stop that. Like, you're not pregnant. Don't rub your belly. Right. But it's like, it just feels so big. And so I know, like, I've talked to some people at the gym about it and just in general, and they're like, oh, well, they're like, I think it's like not more in your head, but like you're noticing it more than others. Mm-hmm. I'm like, well, yeah, because I'm not flabby and soft. I'm like full of fluid, but I'm like 67 kilos right now.
Right.
That was like,
in general.
Yeah, I feel thick. And then like my boobs now are super sore, and I can start to feel like that I'm holding, hopefully more water like around my kind of lats and my back. So all my bras are starting to feel tight. And I just feel like, I'm like, I really hate to use this word, but I feel gross, and I feel cheated in a way, because it's like, I'm not even fucking pregnant. Right. And I just like, already I'm feeling like I'm basically at the same weight that someone would be at the end of their first trimester. Mm-hmm.
I bet that's extremely difficult, but if you want to touch on that a little bit, coming from a cut as well, since you just did nationals and you were at a very lean state, and then jumping right into this, that must play some mind games on you.
It is. And, I have to say, like, the gym that we're at now and that people are around now are phenomenal. But like, historically, I come from a place where I feel, because of my job, that like my body has to be not perfect, but it has to be as it is at all times. And I do tend to fluctuate in weight a fair bit just normally anyways. But I remember like there would be times when I'd go into the gym and I'd be like, close to getting my period and I'd still want to like work out with my shirt off. I'd take my shirt off and people would comment about like, oh, looking a little thick today, because I didn't have like a full 6-pack compared to normal, you know?
Yeah.
And so it's like, I've kind of had to, and I'm not getting that right now from the people that I'm around, but it's always in the back of my mind that like people are always watching and they're always judging, and you're a nutritionist and a nutrition coach, so you should, you know, look like this a certain way. And I think in a way, being so vocal about my journey, and most people at the gym know and stuff like that, is like, it's almost a protective mechanism. Because it's almost like, hey guys, like this is happening. This is why I might not look my normal self, which is terrible that anyone would need to feel that way. But I'm pretty comfortable and confident in my body and kind of my variation of forms. And so if I'm feeling that sort of pressure, I imagine that that's pretty significant for a lot of other people.
Yeah,
right?
if it's just so general in society that people are going to make those comments, whether it be to your face or behind your back, just telling people what you're going through so that they have an explanation, that they don't have to wonder or talk about it. It's just like, all right, we know what's going on and we can get behind her and support her throughout her journey.
And it's so unfair because I feel like, you know, there's so many people that go through this, and not just once, like over and over and over and over again, and like back-to-back cycles, and don't want to talk. Maybe they don't want to talk about it with people because it is difficult, right? And it hurts, and you know, there's a lot of feelings of like self-failure, which are very, in my opinion, misplaced, but they exist. And so, you know, and so, yeah, I think just like, it's kind of a lesson to just back off and be more supportive generally, right?
Yeah, regardless of what people are going through, or if they're going through anything.
Exactly. Or like they just,
because
this is
people out there who
post weekend.
Yeah, post wedding. There's people out there who go through this, like we were talking about, who don't have the opportunity to talk to people about it, right, and express what they're going through. So I think that the prevalence of that just goes to show, okay, like just support everyone that you see out there, right?
Yeah, absolutely, 100%. So it's been interesting because I think already I'm starting to see some of those like body image issues that I've seen and supported so many women through during their pregnancy. And you look at them, they're like, oh my gosh, I feel so big, or I feel this, or I feel that, or whatever. And you look at them and you're like, you look amazing. And also like you're growing a human
person in you.
But it doesn't negate the fact that they feel that way, right? And so I think we do need to respect that and understand that. But so yeah, it's like there's that. And then I think for me, like the performance piece is not an issue right now, but I foresee that coming. Like there's going to be a day when I need to like start pulling it back and reining it in a little bit, or just you know, my effort, my 100% is not going to yield the same results as it does today.
Right.
And I think that's going to be really tough too.
So that's how we correlate our performance to our nutrition and our body image and everything like that. So when
our identity.
Yeah. So when one piece starts to fall sort of out of our control, I mean, this is obviously your decision, so it is within your control, but at the time it's going to feel very out of your control. And that's what's really difficult too. It's like with any injury or anything like that that's kind of setting you back, it can be really difficult, and it can seep into our body image and everything else, food guilt, all that sort of thing too.
Yeah, and it's interesting, you know, I had an email from the owner of our gym who was kind of reaching out and saying, look, I don't know what your athletic goals are for the year ahead, but if you want to sit down and have a chat, I'm available, which is very sweet. And I just, you know, as I am so open running about, I was like, well, I don't know either. I was like, I don't know what the next year holds for me. I was like, this is what we're going through. This is what we're trying to do. So I anticipate that, like, you know, soon down the road, I'm really going to need to shift my focus onto not just how I can maintain, but things that I can actually improve over a pregnancy, right? So whether it be like honing in on specific tech for some things, strict strength, stuff like that, like I need to have something positive to focus on, not just on maintaining.
Yeah,
because that will drive me crazy.
Not just on what you can't do as well, right? That's been
Absolutely.
a big theme going on, especially when we chat with Ben, is like, hey, focus on what you can do, not what you cannot do.
And I think that that's something that, you know, we talk a lot with our clients about, even in, you know, those like the most perfect ideal pregnancy that goes completely according to plan. It's like, okay, let's focus on what you can do over this time, to maximize your health, your baby's health, and then like your return afterwards, right? So much research has been done recently that shows that it's actually the maternal diet, not just during pregnancy, but in the months and the years leading into pregnancy, that can determine a child's experiences of chronic illnesses. So things like metabolic syndrome, diabetes, heart disease, things like that are all really highly linked to maternal diet. And so it's like, okay, things are not going to be perfect. There are going to always be things outside your control. You might have like the worst protein aversion on the planet, but what can we do to like optimize that as much as possible?
Right.
So I think for me, in terms of like body image and performance and nutrition, it's like, I know that I'm going to struggle with some of those things. And so focusing it on, okay, what can be done? What can we do? Is going to be pretty massive going forward. Because yeah, like a week and a half into my first cycle, yeah, things are going, I mean, I'm starting to feel over this popcorn making right now. But I'm like, well, hopefully this is just like kind of like a prequel to what's ahead anyways, right?
Yeah.
But it's been relatively easy. I was expecting a little bit more craziness, but that being said, I'm on the 2 injections right now, and then we're expecting that like maybe Tuesday I get that HCG trigger, and I have heard that makes you batshit crazy.
Maybe we should go with you and with Ben for that one, so we can get kind of both sides of the story. No, I'm just kidding.
Yes. So, I mean, that might be an experience, but yeah, I've got another scan tomorrow morning, and then we'll kind of have an idea of what the rest of the week is going to look like in terms of surgery dates and stuff like that. So
Excellent. Well, I'll look forward to sitting down with you again and kind of hearing about the process after this week, because it sounds like things are going to move pretty quickly, and there's going to be a lot to kind of document and a lot to share throughout the process. So hopefully we'll be able to sit down quite often and get the insight on what's going on, because I'm sure a lot of people are going to be able to learn a lot, whether or not they're going through IVF, whether or not they've been pregnant, planning on getting pregnant, or currently pregnant. I think there's a lot of good takeaways from the experience that you're going through for everyone.
Going through it too, right? Like, you know, different people are going to want to share different amounts, and I'm pretty open to sharing all of it, probably too much of it, but it kind of gives you like some insight too, that if you have someone that you know is going through it, it's like, oh, okay, right. I get it a bit more, and this is like how I can be like a good support person, right?
Definitely, which is so important, like we said, because a lot of people don't feel like they can really talk about it or open up too much about it when they are going through it themselves. So being able to have that insight.
Or maybe they're just too damn tired. They just need to go have a nap on the bench and not talk about it.
Exactly. Well, thank you so much for sharing. I know that it does come naturally to you, but it still probably is not entirely easy to really talk about all of this and share it with everyone, especially when it was so unknown from the beginning. But now you know you have a large support system and community behind you guys, regardless of what happens. And there's going to be a lot to get out of, like, we're all going to gain a lot from this experience. So thank you.
Absolutely. I hope so.
Yeah.
All right. We'll chat with you soon then. To be continued.
To be continued.